Hey guys, today I want to run through what we do to fix plantar fasciitis. So there's three main techniques or modalities that I use. The first one being active release technique. And what I'm going to target is the plantar fascia, the stabilizing muscles of the ankle, as well as the calf. Once we've sort of worked through that, I like to use some fascial scraping through the plantar fascia itself. And then we go into some dry needling. So let's get into the ART of the plantar fascia to begin with. So for this one, I find that most of the tension through the plantar fascia is sort of as it sort of emerges out into the upper sort of part of the foot there, we find just here, that's where it really gets junked up. So what we do, come onto here, and I'll start with some sort of broad sort of stretching through that. I want to do a few passes onto that fascia. Once I find the spot that really needs that extra attention, get in there, 2 thumbs, and I'll use my shoulder to really get that extra stretch. Now for someone with plantar fasciitis, they're really going to feel a deep pulling sensation with that as the sort of fascia releases. And it's fantastic to get those quick changes through the tissue. Now, obviously the plantar fascia, that's the symptomatic issue, the one that we got to sort of change the tone of to change the pain. But why did that get overloaded? And that's where I start looking at the ankle stabilizers. The two main ones being tibialis posterior, which is sort of just under the shin in here. And then sort of the opposite muscle to that is the peroneals, which runs from behind the fibula and sort of wraps down all the way behind the lateral malleolus into the outside of the foot. So we're going to get into this muscle next. So Ling is going to help me here. He's going to start with his foot down and out, and we're going to move up and in like that to really get that good stretch through that muscle. Let's go, Ling. Great. Get a little bit more tension there, and up you go. Fantastic. I can hear Ling's really feeling that one. So Ling plays a bit of basketball. Obviously, huge demands on ankle stabilizers for that one. So he probably needs a little bit of this. We'll go one more pass through there. Great. Now, still on. The next tissue we want to hit is that tibialis posterior. So onto your side, Ling. And if his peroneals were that tight, I have a feeling this muscle is going to be pretty nasty for him as well. So for this, what I like to do is we start side lying. Patient will have the foot lowered. They're going to raise it. And I'm going to put a bit of overpressure as we stretch the muscle. And I'm going to get into the tissues at the same time. So let's start low. I'm going to get onto that muscle. And then taking the foot up. And I'll put that little bit of overpressure there. And then coming up. This is one of those muscles that, you kind of get away with, not realizing how freaking tight this thing can get. And then the tibialis posterior is probably the main issue when it comes to shin splints. So if you leave this one alone and it sort of gets out of control, that's what you'll sort of develop. All right, so now that the tibialis posterior is sort of all the pressure's taken off that, the ankle stabilizers are feeling a little bit better. The next one we want to work on is the calves, the Gastrocnemius and the soleus. So Ling, let's go face down. So there's two sort of methods I use for this. So the soleus predominantly works when the knee is bent. So I like to release it when the knee is bent as well. Sort of starting with the ankle down, and then we're going to take it through the range like that as we work on that tissue at the same time, getting the stretch through there as we're loosening that up with some pressure. So the calf is a huge player with plantar fasciitis. So what you'll find is the tension in the calf, it will sort of, all the fascia that sort of goes through it, it'll sort of tighten up and pull this way, and that whole fascia through the plantar here will pull this way, and then it starts frictioning and tightening through that point there. That's why it's absolutely key to take all the pressure off through this. So once we've changed the tone of the soleus, we go up higher into the head of the gastrocs there. So Ling, just come down a little bit towards me. That's good. Similar sort of motion of the ankle. We start here, get the tension on the muscle, taking that up. And then Ling, you're going to point the foot up towards your head, and I'll put some overpressure with my knee there. Good, and coming back down. Go for it. Now again, with Ling's basketball, he definitely needs this. Now, I'm not going firm at all on Ling, but there's just a lot of tension, a lot of trigger points through that muscle. Go one more pass. So now that we've sort of deloaded all of the soft tissues, the main contributing muscles to the plantar fasciitis, next up I want to do is a little bit more work on the plantar fascia with some Graston technique through the plantar fascia right here. So what we're doing here, we get some stretch through the fascia there, and then we're just sort of almost shaking free any sort of adhesions, trapments that we get on the bottom of the foot. Now this one, it can look a bit full on, the fact that we got this metal tool scraping like this. This is a lot more comfortable than the active release technique. It's probably one of the nicer things I do for my patients. We don't use Graston technique for everything, but there's certain injuries that I find it's just amazing for, and this is one of them, the plantar fasciitis. So to really get the results with this one, I'd probably do this for about 5 minutes or so. I'm sure you don't want to watch 5 minutes of me just scraping a foot. So we'll move on next to the dry needling. All right, now that we've taken some more load out of that sort of plantar fascia there, the next step is some dry needling to increase the blood flow as well as sort of deloading the muscles a little bit further. So what we're going to do to start with is some sort of the main trigger points that you get up through the gastrocs here. We're going to hit those. Now, Ling's very excited about this. Now, if you're enjoying, looking at these treatment modalities and how we work on different injuries, please subscribe to the channel. That sort of helps us grow and gets you guys more content like this. Nice little twitch at that point. Go one more into here. And finally, we're going to get one into the plantar fascia itself. I only like to do one, especially on people's first appointments, because the plantar fascia, obviously a little bit more sensitive on the foot there. So like I was saying before, that point, just where I find all that junk as the plantar fasciitis develops, here, get it straight into there. Just like that. So what we'll do is we'll let that sit for 5 to 10 minutes, increasing all that blood flow. And that I find just works wonders when treating plantar fasciitis, whether it's acute or chronic. Patients love this one. Thanks for watching, guys, and I'll see you next time.